Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And we're diving into a Step Ahead Foundation of Middle Tennessee. We're honored to be joined by Jenny Matthews, Executive Director, and Caina Lynch, Community Program Manager with a Step Ahead Foundation of Middle Tennessee. How are you two doing?
Good. Hi, Jeremy. We're doing great. Thank you for having us.
Absolutely. So we're going to talk all about how you power the good throughout Middle Tennessee, but let's start with a little bit of history and some context. Give us some background for a Step Ahead Foundation of Middle Tennessee.
Yes, we have been doing our work here in Middle Tennessee since 2016. We've been serving women with long-acting reversible contraception. So that's 3 to 10-year birth control, the IUD or the implant. In the 7+ years we've been doing our work, we have served 3,500 clients through our healthcare services. So that's something we're very excited about as we have gotten busier and busier. When we started, we were in 7 counties. And we've been fortunate enough to expand to 29 counties in Middle Tennessee.
Talk about where the unplanned pregnancy rate was and where it is now. So let's kind of back up and look at the big picture around unplanned pregnancies. Give us some background on that side.
Absolutely. As you know, data runs a little behind. But when we started this work in 2016, the unplanned pregnancy rate was reported in Tennessee as 56%. So more than half of pregnancies were unintended, which is really interesting when you think about it. The latest data we have shows that 43% of pregnancies in Tennessee are unplanned. So we've seen, a nice decline, and we'd like to think that some of that can be attributed to the work we've been doing in Middle Tennessee.
Absolutely. Talk about why that's important. I think, for the audience, you think about, okay, the ability to plan the pregnancy. You think about financial stability, you think about family stability, you think about being able to have a more solid career path and trajectory versus unplanned and, kind of dealing with that side. So talk about what that means in the larger context around the individuals in the family, but also the community side as well.
Certainly. So this really just empowers women to, you touched on some of the things, focus on their education, finish their education that they've started, get into the workforce or continue on their career path. Oftentimes we work with organizations who are working with women who are focusing on themselves in a really beautiful way. I'd say a job training program, a substance use recovery center, many different avenues that way. People who are experiencing homelessness, who are trying to find stable housing, and unplanned pregnancy just really makes it more challenging to be successful in whatever you're focusing on. And we know that when people have children, when they are ready and prepared, we know that their success is so much higher in everything else they do. That home life, that family environment is a lot easier, I would say, for the family unit to be a little more stable and happy when children are in the household, when the parents are ready for it. Additionally, broader within the community, we see huge ripple effects. And so we think really at the micro and the macro level, the work we're doing is hopefully having some big impacts and just creating some stableness for our community.
Yeah, and I think that's always the interesting perspective is you think about the impact, at the individual level, at the family level, but then at the larger community level in terms of, why this needs to be something that everyone cares about and why it's so important, that ripple effect like you're talking about. Caina, what would you add to that? And then we'll talk about community partnerships and collaboration, but what would you add to that sort of context?
That it's just really empowering to hear the feedback and the stories from some of these women, whether it's through our education, through our community partner programs, or from just our clients that follow back up with us, and hear how much of a difference these services really are making in their lives. I'd actually love to share a few clients from some recent clients of ours. And these recent quotes, so one woman shared that it will give me peace of mind knowing I won't have to worry about pregnancy when I can barely afford to live myself. Another recent client shared that having access to a long-term birth control method will allow her to enjoy her life without the worry of an unplanned pregnancy while I focus on school and progressing with my career. And then this was a really good one to hear because we have a high demographic of clients who are already mothers. And so we have one client who recently shared that this will take away the worry and allow me to focus on my twins.
Yeah, and actually that's a great, before we talk about collaboration and partnerships, then let's talk about, give us a picture, an illustration. And obviously it's very broad, but when you talk about ages, demographics, and like you said, even those who already have children, give us an idea of the women and what they're dealing with. So give us a little bit of an illustration around the women you serve and help and support.
So obviously, as you said, it's very, very broad. We serve students who are in a community college setting. We serve people who have had 4 and 5 children, and they know that they're not ready to have another child. As Caina touched on, more than half, so about 60% of the clients we serve already do have a child in the house. Oftentimes, the people we're serving are having a difficult time accessing healthcare. So I would say about 85% of the clients we serve do not have health insurance. However, that is not a requirement for our program. So actually, in order to qualify for our services in the 29 counties, someone must be a resident or a student in one of those 29 counties. That is it. There's no income level, there's no health insurance status, and there's no documentation status required. So that is the one guideline required. And so we really are seeing people all across the board who are seeking our services, and a large percentage, the majority that we serve also are unwed.
So you all are literally at a community partner right now, but talk about the partnerships, the collaboration, and your approach that makes all this possible.
So our outreach program is really geared to helping build these relationships in the community to help us connect and get these resources out to the women that are in need of our services. So we build these partnerships with community organizations. We now have over 100 partners in prevention in our 29 county service area. And these partners, not only do we work with the staff so that they are aware of our program and how to refer to us, but we also utilize their services to then share with any of our clients that may need those resources. And then we work together with these partners to take it a step further and provide education. So we have a few different education programs that we offer. So one program is what we call our Family Planning with a Step Ahead, which is geared towards adults, whether that's couples, whether that's groups of women or men, where we're able to come in and talk about the importance of family planning and how it can affect our lives in the futures, and the resources that are available for STI and pregnancy prevention. And then we also have a young adult and teen program that we call our Real Life Real Talk, where we're able to connect with these young participants and talk about the importance of all things family planning. So consent and healthy relationships, talking about abstinence, as well as STIs and pregnancy prevention, so that they have the tools that they need for down the road whenever they are starting to plan their families.
Yeah, I know that can be a very difficult conversation, the birds and the bees with the parents. And so having you as an access point for education, I think, is really critically important. Share a little bit of, when you look at the education side, give us some of the magic, if you will, in terms of the aha moments or the light bulbs that you see for the participants as they go through. What are some key takeaways, especially from your personal vantage point, that are just special moments as they go through the education side?
It's always really nice at the end of a session when someone just shares, "Oh, I need to call as soon as possible." And it's just that being able to connect these resources to people. But occasionally there will be a mom in the room who's like, "My teen daughter really needs these services." And so it's pretty broad. And I always love whenever I have the opportunity to lead an education session, because someone's life is always changed in a matter of 30 minutes to an hour.
You mentioned some of the different on the education side in terms of what women have access to. Go in a little bit deeper on that side in terms of educating for the audience who doesn't know all the different opportunities out there. Give us kind of a little bit of an a la carte menu in terms of opportunities for women.
So education is a huge piece of what we do, but if someone does want to take it a step further, We have a wonderful staff-led call center Monday through Friday, 8 to 5. So if someone is curious about long-term birth control, they can call us, they can ask us some questions. We are not medical providers, but we can help facilitate to get them to a medical provider to ask the really deep questions, the burning questions they have. And so we are that kind of warm initial place where someone can call. Oftentimes for people, this is, something they push to the back burner or something they're not super comfortable with talking about. And so we hope we can be that friendly face. So if someone wants to explore this, we can set them up with one of our 14 clinical partners. We do that. We have clinical partners within 4 of the counties that we're in. And so we can provide transportation to and from any appointment through Lyft completely free of charge. So that's kind of the first barrier that we would kind of hopefully knock down for someone. And then at that appointment, they receive a well woman visit, an STI test, a pregnancy test, and then this contraceptive conversation that they get to have with a provider. And then if they decide that they want an IUD or an implant, we actually have hormonal and non-hormonal IUDs that we cover. They can receive that same day sometimes. Other times they come back for a second appointment. And then we cover removal at any time. So that's another barrier that we're breaking. Oftentimes, it's nice to know that you have coverage for it, but then the fear of what if I want this out in a year? What if I want it out in 5 years? How will I cover that? So that guarantee of the cost will be covered on the back end as well happens. And then they really get to kind of move on with their lives and live their lives. We do survey them at the end and as follow-up, and we hear just wonderful quotes, some that Caina said. And then the client should never receive a bill. We cover that cost. So everything we do is completely free of charge within the clinical setting.
I view it a little bit when you talk about the importance of like a mental health conversation and opening the floodgates, reducing the stigma, breaking down those barriers. To me, these sort of conversations flow in that same vein. Is like, we've got to break down those stigmas and reduce the intimidation factor and normalize it so that when you talk about women's health, they have access, education, resources, they know where to go to turn to. I think all these are very important conversations. Touch on then the community support, because obviously you've got events that people can plug into and support your efforts, obviously being a nonprofit, financial contributions to underwrite your efforts, but talk about community support.
It's been amazing. I'll start with that. As Caina touched on, all these community partners we have, but we really existed the first handful of years from local foundations and individual donors who believed in what we did, who really saw what we did as pretty narrow in our scope. And we have been, I think most people can get behind the work we're doing, and no matter what their why is, I think we've got a lot of support that way. We also have larger foundation support now. In fact, we're getting more funding from new partners, which is really exciting. And then last night we had a new event, which was really fun, around World Contraception Day. And so we partnered with 16 restaurants. Most of them were in East Nashville. And those restaurants chose to give a percentage of their proceeds back to us. So that was really not only a fundraiser, but a community awareness piece where we've got 16 restaurants buying into what we're doing and supporting us that way. So we've had, I like to feel like we have warm welcomes and a lot of really wonderful support throughout our community. And also from faith-based organizations, we have great support as well.
You have an event coming up in March 2024. Tease us a little bit with that.
Well, it is our annual event. It's called Brunch and Bubbly. It is this time, it's the first time it is a ticketed event, but open to the public. So we're really excited about that. We are going to have some hands-on experiences for the people who come. So they're going to get their hands on the client bags we give post-appointment for our clients. There will be some real life activities, hopefully, that people will leave with and feeling like they're actually touching our mission outside of financial contributions there. And of course, we'll have great speakers, and it'll be a really fun time. What we love about it is it's a Saturday. People can come at 10:30. They're out by noon, and they've got their whole weekend ahead of them. And they've also done something pretty fun to start their weekend.
What for each of you puts a smile on your face when you look at what you're doing, but most importantly, the impact you're having What puts a smile on your face?
You know, all of the client quotes that we get, the feedback, we're about to do an education session here in just a little bit. And something I hear often that puts a smile on my face is people hear about what we do and they say, but what's the catch? Like, is it really free? And in order to tell, the ability to tell people it's really free. People who have expressed that this has been a burden to them in the past and accessing healthcare like this, because without insurance, this can be $1,500. I think the relief we see on people's faces for me is a true joy. And then the stories we hear on the back end with participants that we, do education with or work collaboratively with a community partner for education. And then we hear a story from a client where they follow up a few years later and talk about how, they finished their college degree or they've got a baby on the way when they're ready to have a baby on the way. It's just really rewarding, fulfilling work.
It is. Those are all things that make me smile and that I love about my job. One thing that I think that's a little bit on a different note from that is if we're tabling at an outreach event and someone approaches our table, they've never heard of us before, and then they walk away and they're just like, this is amazing. I can't wait to tell everyone about it. Because since we are still on that smaller scale of a nonprofit, we're still getting that awareness out. Whenever we do impact those people that just want to support us or spread word or utilize our program, it just makes me so much happier that I'm out there in the community and connecting and networking to help expand these resources for everyone that needs them.
Well, when you talk about helping to raise awareness and open up the access points and get the community involved, where do we go to learn more? So website, social media, where would you direct us to go?
Our website is www.astepaheadmiddletn.org. I'm going to let Caina do the social. She's our social media person, and I don't want to misspeak.
So we are on all of the platforms, of course, Facebook, Instagram, we're even on TikTok. So A Step Ahead Middle TN is going to be our handle on those platforms. And even on the professional side, we are on LinkedIn as well.
Makes it very easy. Once again, the website is astepaheadmiddletn.org. So that makes it easy to find all of the information and to get involved. Jenny, Caina, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you for having us.
Thanks, Jeremy.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.